The Wellness Hour, an in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know about how to improve your smile. Today's topic, cosmetic dentistry, what's new breakthroughs, how to create a natural-looking smile with Dr. Atcha. Dr. Atcha, welcome to the program.
Thank you, Randy.
And we've had you on the program talking about dental implants and sedation, and I guess you're known as a cosmetic dentist, or what do they call you?
I have cosmetic training.
All right.
So cosmetic dentistry is very broad, but there are so many aspects of cosmetic dentistry.
What are the categories of patients, I guess, as far as cosmetic dentistry?
It could be veneers. It could be simple thing is just whitening. Simply whitening your teeth.
Is that the most popular procedure?
That is the most popular procedure, Randy. Whitening your teeth. It could be Invisalign, straightening your teeth. It could be just cosmetic recontouring. Just a little minor changes to the edges of your teeth can just really dazzle, just bring out your whole beauty, your whole smile.
All right. And
porcelain veneers. Veneers.
Yeah. Now, do you do things like Invisalign and things like that?
We do in our office with the four of us. We do more Invisalign than anybody else in our area.
Is that right?
Yeah, we are very, very busy Invisalign office. And patient comes in with minor spaces between their teeth, and I would say about 70% of the patients that need any kind of correction in their appearance, their teeth, with their space, a little crookedness, we can correct them with Invisalign without the actual braces.
But in this economy, is cosmetic dentistry way down? I mean, as far as people wanting to, because I know you do dental implants and people that are disastrous situations, but people that are coming in for veneers, should they? I mean, give us your take on why you should improve your smile in this economy.
People actually are spending money on cosmetic dentistry because you know what? They got to go compete for that job that they're going to get. They want to look good for their job interview. They want to be more marketable to their employers. They want to be better salespeople. Who are people going to trust? People trust people with a nice smile because they're more approachable. So absolutely, even in this down economy, people are actually enhancing their smile and they're investing in themselves.
Okay, now you call it smile design or customizing a smile. And what makes up a good smile? I mean, if you had to say, what's a good smile?
A good smile, for example, a feminine. You want to have a nice, softened smile.
For a woman. Obviously.
For a woman,
Okay.
And it all depends on everybody's facial profile, their skin tone, their complexion. Some people want, there's different types of smile. There's vigorous, there's dominant, there's aggressive, there's a Hollywood smile.
I mean, describe what you're talking about, by the way. Like what makes up a feminine smile?
A feminine smile is the teeth are, they're not very perfect, but they're very rounded. The rounded is a very, very feminine smile. Like a youthful smile. I'll tell you, a lot of younger patients want a youthful smile where the two front teeth are a little bit longer.
Okay, good.
And then the side teeth. A lot of patients want a Hollywood smile where all the teeth look straight and even.
Okay.
So that it's what the patient wants, and also we help them that this is what we feel is going to be best for you.
How much say-so does a patient have? Okay, so they go in. How much say-so do they have in what their smile is going to look like? I mean, what's that process like?
They have a great say-so because when we sit down during the consultation, we give them a mirror, and first of all, even before that, what we do in our office is we're very big on imaging. So when a patient comes in, I ask them, begin with an end in mind. What do you want to see different in yourself?
Okay.
They'll say, doctor, I want my teeth to look like this. Okay, well, we take a picture and we image it. We image it to what the patient told us and to what we think is going to be the best
So you take
option.
a picture of them.
Yes.
Computer imaging of their teeth.
Computer imaging of the teeth. And then they come back and we go over and we ask them, okay, what do you think? Okay, how do you feel? We'll do 2 or 3 different smiles.
Is it pretty accurate though?
It's pretty accurate.
Can you accomplish what you show them on the computer?
Absolutely. Because if they say, you know what, this is me, this is what I want, then we take that image and then we communicate with the lab that patient selected this. This is the tooth color, and the shade selection. That's a very extensive process. A lot of times you see crowns with just one color. They just look big, white, chalky, bulky teeth.
Interesting. So there's multiple colors in a tooth.
Absolutely. There are multiple shades in a tooth. There could be on the end of the tooth, on the tip of the tooth, and usually the tip of the teeth, the edges we want them a little bit translucent, so that way it doesn't look very, very unnatural. So the patient has a lot to say. We do the imaging. From the imaging, we let the patient decide what smile they want.
Do they ever bring in pictures of celebrities?
They bring pictures of themselves, actually.
They do. Okay.
If, for example, if somebody has crooked teeth or somebody has decayed teeth and they want a nice smile, they will bring a picture of what they look like before they had the disease process, and they say, "Doctor, I want to look like what I used to look 10 years ago or 20 years ago." That helps a lot.
Okay, so they pick their smile.
Right.
Now what? What happens next?
When they come in the day of the procedure, and they have temporaries placed on the day of the procedure. Okay. The temporaries allow them to see what their teeth can look like.
So what are these temporaries?
These temporaries are plastic. They're made by the lab. They're custom made to their smile that they selected. Okay, and the shape they selected. So when we give them temporaries, we give them a mirror, and a lot of patients are like, "Oh my God, this is what I want. I can't wait till I don't even want my permanent porcelain teeth."
Okay.
But the temporaries allow them to, hey, we establish their bite. We establish their smile. If anything we don't like, I check from different angles to make sure that they're happy. We make sure that the patients, is there anything we like to change in their temporaries, we'll change it. Okay. They'll wear temporaries for about 2 weeks until the permanent.
So they can eat with these and those things.
They can eat, but they have to be careful. They have to be careful so that they don't floss very aggressively. They can brush just like they would with their natural teeth, but they have to be careful. They can't chew anything hard. Okay. They come back in 3 weeks, and after we remove the temporaries, I place them with a temporary cement. Okay, we put them temporary cements and we give it to them and say, "What do you think?" Okay, we give them the mirror.
Okay.
And I would say almost all the time, patients like, "Let's get them in. I'm very happy with
All right. So the day when the porcelains are on.
Right.
Then, and by the way, for the highly anxious patients, we haven't mentioned, you do IV sedation.
Yes.
And what's the percentage? Half the people are doing it? Some of the people?
I would say 50 to 60% of my practice is high fear patients. So patients that are looking for a nice smile, well, they're also very, very fearful. But through the process of IV sedation, they're able to get their cosmetic dentistry done.
Okay, what are the frequently asked questions? Okay, so somebody comes in, they don't like their smile, they want to pick it up a notch, as you say. When it comes to porcelain veneers, what do they want to know? What are they asking you?
The question that we get asked frequently is it going to hurt? Okay, well, it doesn't have to hurt. It's not going to hurt because we make sure the patients are comfortable. The other question is, am I going to be without anything when I leave the office when they come for the procedure? But they don't. They're going to leave with nice looking, beautiful temporary teeth.
Okay, can it be life-changing? I mean, you say it changes people's lives.
It absolutely is, Randy. It's a life-changing event for patients that do cosmetic dentistry because it brings out their whole personality just evolves. They look good. They feel good, and not only they're happy, but everybody around them happy. It's very
so other people are happy because their teeth are good.
Absolutely.
Why is that? Why would somebody be happy?
Why? Because these people are more approachable. They're more friendly. Everybody wants to be around friendly people. Everybody, if I'm
so you get your veneers, and everybody around you is happier.
Well, because they smile more.
All right. Okay.
They smile more.
All right. Why do you like it, by the way?
I love doing it. This is one of my passion as well. Is because somebody has been hiding their smile, and they haven't smiled, and they want to be able to, either A, for a job interview, okay, B, for their dating life, okay. It's great. A nice smile is great for romance, okay. I have a lot of patients who have said after they got their teeth done, they got their teeth either whitened, they got their teeth straight, or
they met their soulmate.
They met their soulmates, and they're totally different people. So
you hear these stories, and they come in and say, "Oh my goodness,
absolutely,
my dating life is great." Everybody likes nice teeth.
They tell you their story when they're in the office. They tell you their story, and it is just so refreshing to hear that I get into my clinical gear, and I'm doing the best that I can for the patient. But when I'm out of my clinical gear and when I'm hearing this, it just gives me such great satisfaction that it is transforming their lives.
When did you know you wanted to be a dentist? Because you don't look like a dentist, by the way.
What do I look like?
Yeah, not a dentist. I don't know. You just don't look like a dentist.
I wanted to be in the field of dentistry ever since I was in college. I have come from a family of dentists.
Oh, really? Tell me about that.
My uncle is a dentist. I've spent some time with him in his office. He's a general bread and butter dentist. But I just see that how his communication with the patients, how his person. I come from a family of doctors. Let's put it that way. So I have a lot of physicians in the family. I have dentists in the family, and I kind of have to pick between the two professions. And I picked dentistry from the get-go because I like that one-on-one interaction.
But they don't like dentists. That's why I always think that it's an odd profession because do you hear that every day?
I hear it every day. How
do they say it?
Nothing personal, Doc, but I hate the dentist. And again, that comes from their fear. That comes from being hurt in the past.
Do you smile? I mean, do you have a routine since it comes up all the time? I mean,
you know what? You have to laugh it out. Because if you're serious and you get defensive, it's just not going to go anywhere. And we laugh it out. We say, you know what? I don't like patience. What are you going to do about that? But it's, you break the ice.
Okay, so you brought some photos.
Yes.
What are we looking at over here? Oh, by the way, and about veneers, the gray line that you see over the edge.
Yes.
Is that the veneer? What is that?
It is.
Are those veneers when I see that?
That's the metal. Now, the old way of doing it was the porcelain is baked on the outside, but the inside there's a metal for structure, for support. What you see, the gray line, is when somebody's wearing crowns for a long time, with a single tooth or multiple teeth in their front teeth, their gum tissue responds to that metal or responds to the porcelain, and there's a little shrinkage. So when they smile, what they see, the gray, is the metal exposure.
The metal, but that's not what we're talking about today.
In our practice, those kind of crowns are done for the back teeth, but for the front teeth, we don't put any teeth with metal. With the newer types of porcelain, with the newer cosmetic materials, you don't have to. You literally can't even tell if they had any work done, and you just don't see metal at all anymore.
So let's take a look at some of the photos.
Sure. Here's a photo of a young lady. Okay, she had a lot of problems. She had the gum infection.
Yeah, what is that, by the way?
She had the gum infection. She had periodontal disease. She had a lot of teeth that were gone bad due to decay. That's just from, again, she was a patient that was very high fear. Okay, she knew she had bad teeth, but and she's a young patient. She's in her 20s. She just didn't want to go to the dentist because she was afraid she was going to get hurt. She had needle phobia. She didn't want to get, she was afraid of the needles. This is the person, Randy, that doesn't smile. Okay, she hides herself. She's very young. She does have self-esteem issue. Okay, because she doesn't smile. Now, these people, there are people like that you see every day, but you just don't see them because they cover their smiles. Okay.
Wow. I mean, that's a bad one. So what can you do? Do those teeth have to be removed?
Well, no. Fortunately for her, that we did not have to remove the teeth. We cleaned her gum infection. All the front teeth, all front six teeth need to have root canals done because the cavity was really, really bad. It was all the way. So the fortunate part was that we were able to save the teeth. We had to do a little bit of gum lengthening to create more room for the crowns, and we actually look at her after. Look how nice her smile looks now.
Okay, very nice.
And free of gum infection. The teeth are much more stronger. They have the porcelain crown, and on this one, you're never going to see the dark line. With her, we gave her beautiful looking 6 front cosmetic crowns, metal free, and after placing them, we gave her the mirror, and actually we closed her eyes, and then we tell her, okay, now open your eyes, Victoria. When she opened her eyes, she could not believe how amazing she looks, because when she came into our office, the teeth were really broken down. She was hiding her smile.
Yeah, I mean, this before is unbelievable.
Oh,
That's got to be rare. That's got to be rare.
She was not a happy camper. When we placed the 6 porcelain crowns, we gave her the mirror. She started crying. I mean, it was crying. Her grandma was in the room. Sister was in the room. It was an emotional experience for her. She's very happy. When we see her for a follow-up, she looks good. She feels good. And she's just, their whole personality comes out.
Is this one of those things, by the way, where people say, I should have done this years ago?
I hear this all the time. They said, I don't know, doctor, I don't know why I waited, but they always say that I wish I would have done this a long time ago. All the time.
Okay, you have other photos. What are we looking at here?
Absolutely.
And the patients, are they usually like 30 plus, 40 plus, 50 plus? Coming in for veneers?
The patient ranges can, like I said, they can range from in their teens, 17, 18, 19-year-olds. They can go all the way up to their 50s and 60s. So there's never age restrictions on when you can have a beautiful smile.
Okay. So we're looking at what here?
Okay. So here's the patient picture of a patient. You're looking at patients that have, this is what you were talking about, the dark. She's not, when she smiles, she sees a dark line on her gum line. Okay.
I see that.
And you can see.
So what is that then?
These are porcelain fused to metal crowns that are replaced on her front teeth.
Okay.
She's not happy because her teeth look very.
Because it's a good looking smile though. I mean, it is a nice smile.
Yeah, it's a nice smile, but she was not happy because her you can look at her teeth. They're yellow. Her upper teeth are yellow. The porcelain, the match, they're not matched to her lower teeth, which are natural teeth.
Okay.
When she smiles, she sees the dark lines, and that's something that she's not happy about. And she's a very successful businesswoman. She owns her own IT business, and she's a very nice person. She's very successsul, but she's just not happy with her smile.
Do they not want anybody to know that they had this work done? Is that a concern, like when she goes in?
She said, people don't notice, but I'm doing it for myself. I notice it.
Okay.
She said, I notice it, but I want to be able to, when I'm doing my presentation, when I'm in my sales meeting, I want to be able to have a nice smile. And right now, when I see myself in the mirror, all I see is yellow front 6 teeth, and when I smile really big, or when I laugh, people can see my dark metal that shows.
So what did you do for her?
Well, look what she looks like now. What a difference.
Okay. Very nice.
What a difference. What we did was we removed the front 6 teeth, which were all porcelain to metal, and we gave her a beautiful smile, custom fitted to her face, her profile, and we kind of lengthened the teeth a little bit. We did some gum lengthening, and you can see how feminine it looks. It just brings out her own, her whole beauty. They look good.
Also makes somebody look, I don't know her age, but it makes you look younger.
It does make
I'm
her look,
noticing when,
she's in her,
when you have wider teeth.
Absolutely. She's in her mid-30s, but with a smile, she looks a lot younger. She looks, and if you look at her,
and healthy too,
and
healthy
look, and healthy. And if you look at the new teeth, they look much more natural. They're very translucent. You can see it's not one shade; it's multiple shades, and you can see how one is a little bit. They're not really perfect, but they're a little characterized to make it look a little bit more natural.
All right. Now we're going to take a quick break. I know you have a lot more photos. And we'll be right back. You're watching the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. It's the Extreme Makeover Edition. We're talking to cosmetic dentist Dr. Atcha. We'll be right back. You're watching the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you're considering cosmetic dentistry. With us, we have an expert on the topic, Dr. Atcha. Okay, what are we looking at here? You have some more photos.
Okay, here's a patient of a young female. Okay, look at her. She has spaces. She has spaces between her teeth. She's had these spaces all her life. She is not happy. Okay.
Did she tell you that?
She tells me that, and she refuses to wear braces. Okay. She's been told that she needs to have braces to have these corrected. Well, to me, this is an easy case for me to correct. I can correct this without having braces. So during the consultation, I sat down with her and we said, okay, what is it that you want for yourself? She said, I want a nice smile. I want to get rid of my spaces, and when I smile, I don't want to cover my hand. When I she's a very social person. She works for a PR firm. She is very outgoing, but she doesn't smile fully. So what we did for her was we first did the imaging, and after the imaging, we decided that just cosmetic dentistry, it was not going to be just an option right away, because you have to make sure we get the right results. What we did first was, because we knew that we had to get her teeth first, close the spaces off, we did what's called Invisalign, the clear braces. Okay. Without braces, without the metal. Okay. So she went through a year of clear braces, Invisalign, and after the Invisalign, we did the Lumineers. Lumineers are no preparation veneers. We did 8 veneers on the top and 6 veneers on the bottom. And look what she looks like now. She actually smiles. She's smiling, and she's
very nice.
She's absolutely gorgeous. And this is the day where she wanted to have her veneers before our Kelly concert. So she was going to the concert. She says, it's really important for me to have these teeth before I go. And she works for a PR firm, and she's very active, and
it's a class difference too. I'm looking at it.
It is.
And she looks really well put together there. Very sophisticated.
Very sophisticated lady, and she's proudly displaying her smile everywhere. And now here's another patient, Randy. Look at this young man. Okay.
Wow.
Yeah. If you look at this young man, you can see he's not happy. He never smiles.
So you have to force him to smile.
You have to force him to smile. He's got healthy gums, but his teeth are yellow. His teeth they have spaces, and they're broken down because he grinds his teeth. So, and he does not want to be like this anymore. Okay. Now,
people definitely have prejudged this guy.
Absolutely.
And when you look at that mouth,
just because he doesn't smile, he may not look very approachable.
Okay.
He may not seem like he's a very friendly person, but deep down inside, he's a very nice guy. He just wants to look good. He wants to look good for himself. He wants to look good for his wife and for his kids.
Okay.
Look what we did for him. I mean, he actually needs a lot of dental work. He needs actually full reconstruction. But just to start out with, he wanted to have his front 6 teeth fixed. Okay. And we with a little gum lengthening, we place crowns on the front 6 teeth.
Okay.
And you can see
it's a big difference.
It's a huge difference for him. Although it's the case is not complete, but it's a huge difference for him. This gentleman is not used to smiling, so we actually had to kind of push him to smile for the photo.
Does it take a while for them to get used to?
It sure does. And you can see that before the teeth were really short and stubby. Now they're actually longer. He doesn't have the spaces, and they look nice and natural. And actually, he's a thin, but he's got a long face. So we selected the teeth that are thin and long, and it's kind of fits his facial profile.
Really?
Yeah. Let me put it this way: he's much happier now. People would judge him before because he doesn't smile. He's very serious, but now he's
he looks like a happy guy in the.
He is. He's very happy.
Like a guy that totally different than the before.
Look at the next picture. Here's another patient of ours that has spaces between the teeth. Now, she wanted something that would just close off the gap. So we give her lumineers. She actually tells me that my grandson points the space between my teeth. Okay, she was not happy with it. Okay, she was told she needs to have braces, and she did not want to go with braces. She did not want to have her teeth really cut down to have veneers. She was kind of afraid about that, and she was a little phobic too. But she just wanted to smile for her. She wanted to smile for her grandkids, and it was really important for her to have something that was minimally invasive. Okay. What we did for her was we put 6 lumineers on her front teeth.
Okay, the lumineers go over the teeth.
Lumineers go over the teeth. I barely had to remove any tooth structure. I had to do some minor recontouring, and we put 6. We put on the 6 front teeth. It closed her smile.
Let's take a look.
She's smiling again.
All right. Okay.
And even in order for her to do this, I had to do minor sedation for her because she's very high fear. Okay.
Okay.
So we had to get the teeth ready for the lumineers. But
you call it sleep dentistry?
I call it
sedation dentistry?
Sedation and sleep dentistry. Okay. She had to be sedated because of again, we talked about she was a dental avoider, phobic. With lumineers, we didn't have to remove a lot of tooth structure. I really didn't have to get her numb. We put 6 lumineers on the front teeth, no braces. Her gaps is gone. The teeth are not yellow anymore. And by the way, first we whiten her teeth first. With anybody that gets cosmetic dentistry with veneers or porcelain crowns, we always whiten their teeth. And we do the Zoom, the power whitening in the office, and it gets their shade at least 5 or 6 shades whiter.
Zoom, and that takes about an hour.
It takes about an hour from start to finish. So she whiten her teeth. After whitening her teeth, we gave her 6 lumineers in the front teeth, and it closed her gap, and she's loving it. She's smiling more, and she says, "My grandson doesn't point the space between my teeth anymore."
At the space. Okay, and we're just about out of time, but you have a couple of more photos. Let's take a look. What are we looking at here?
Okay. I have another patient over here. She's not happy with her, again, she's another successful businesswoman. She's not happy with the color of her teeth. They're kind of, they're very yellow, and then they're sort of very translucent. If you look at her before picture, she has actually a very broad and a beautiful smile.
It does look nice, yes.
It does look nice, but she didn't like it. She wanted to make herself look nicer, especially in the front teeth. Now look at this after, Randy. You take a woman who does not smile to actually get her to smile fully, and I mean, she's a beautiful woman, and when she smiles, she's one of those really broad Julia Roberts kind of a smile.
Yeah, yeah.
It took this to get her to smile, and she's very happy with it. Here's a guy who had teeth that were really loose in his mouth. Okay, his chief complaint was, "My teeth are loose. I can't chew anymore because my teeth hurt and they move." As we know, healthy teeth they're not loose.
Okay.
He didn't smile. Okay, one of his main concern was he wants to be able to chew and eat again, and he wants to smile. He's been wanting to get this done all his life.
So those teeth had to go. They had to come.
Those teeth had to go because they were severely infected. He had no bone support. Okay, and he knew they had to go, but he did not want dentures. So we had to do dental implants for him. Now, dental implants. The benefit was he got nice functioning teeth, so he can chew, he can eat properly. And he's got a beautiful smile that he's very happy about.
How many dental implants did he get?
He had 6 dental implants on the top, 4 dental implants on the bottom, and we did the entire procedure in one day. We put him to sleep. When we were done with him, you can see that his smile looks just amazing. Okay.
Very nice.
He's actually smiling again, and he was covering his mouth not only because of bad teeth, but a bad breath. Now the bad breath is gone.
Why is the bad breath gone?
Because the periodontal disease, the infection, the gum infection is removed. Okay.
So when you remove the teeth, that goes away. Okay.
That goes away. He's got beautiful looking teeth that he's very happy to show, and he can chew. He can eat. He said he hasn't had a steak in years because every time he tries to eat something hard, his teeth are loose. They move around. He gets pus in his teeth because his teeth were so bad they had to go.
So it's very cosmetic. I mean, when you look at that, that's dental implants, but I mean, it's a perfect smile.
Absolutely.
It's nice.
Absolutely.
I mean, it doesn't look phony either.
Absolutely.
Like big and bulky.
It doesn't look bulky. Here's what I say when it comes to dental implants, that dental implants, if you take into consideration aesthetics and prosthetics where the teeth are going to go, the surgery makes the surgery a lot easier. So most dental implant should be aesthetically and prosthetically driven with a surgical component. And if somebody is, if I, for myself, I do the surgery and I do the prosthetics as well, so I know exactly where the teeth are going to go because I can begin with an end in mind. I can show the patient what your teeth can look like. Then that drives my dental implant surgery.
With cosmetic dentistry, how much is art and how much is science? I mean, how much is, some people are just better at it than others.
It has to be 50-50 because you have to, you got to know what you're doing from a clinical point of view, but at the same time, you have to you sort of begin with an end in mind of what you're going to do. I mean, your artistic talent has to come through because you're creating a smile for somebody that they didn't have before. Okay. So you got to have a blend of artistic and your clinical ability.
Now, do people do this for occasions? We talked briefly about like they're getting married, their daughter's getting married, they're going to a reunion. What do they tell you?
All the time. I get patients for graduations, prom, young patients. I had a patient that was getting married, wanting to get his teeth done,
or divorced.
And you know what? I'm getting a lot of patients that after they get divorced, what do? The first thing they do is they invest in their mouth, their health. And they get nice looking teeth, because guess what? Smile is the first thing that everybody notices about you.
Okay, you think the smile is the most important thing.
It is
more than the eyes. You think
it is the most important thing in a person's appearance. Absolutely.
All right. I want to thank you for coming to the show. Very interesting. Very good. Yeah. Okay, so these cosmetic pictures are on your website.
They're on my website.
Someone wants to look at it. Consultations. Absolutely. Oh, you're running a special. What is this? Well, this is interesting, by the way.
What we're doing, Randy, is, because we feel so passionate about cosmetic dentistry, me and my doctors in my practice.
So that's an ad you put in the paper?
It's an ad in the paper.
Wanted bad teeth.
And embarrassing smiles.
Okay.
Anybody that's interested in what we're doing is what the study entails is we're studying the strength and the wear of certain dental porcelain. There's more than one dental porcelain to give our patients this results. So we're studying the strength, and it's a 3-year clinical trial that we're doing. So anybody that is looking to enhance their smile can come to us. We can evaluate them, see if they're a good candidate. They have to fit into our candidate criteria. We'll do the imaging, and then we'll see what we can do for their smile. And if they qualify for the study, they get their care done at a discounted rate.
Okay, good. All right, I want to thank you for coming in. Very interesting, good stuff. So if you don't like your smile, somebody watching this, they just hate their smile, what do you say to them?
The message to them is, don't wait. Give us a call. We have changed people's lives. We're creating beautiful smiles, and we can also change theirs. So don't wait.
And they can be asleep while it's being done.
Absolutely, they can be put to sleep, and they don't have to hear anything. They don't have to feel anything, and when they wake up, they'll have a beautiful smile.
All right, I want to thank you for coming on the show.
Thank you, Randy.
Good stuff. You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again online, you can visit our website at wellnesshour.com. You can even just put in Dr. Atcha, and you'll find him there. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news, with your host, Randy Alvarez, the authority on health issues.